Today we have a post that was submitted from, I guess, someone on Facebook, and post reads, "New cancer treatment destroys tumors using sound waves and water." So that sounds pretty cool to me. The technique is actually, though, called histotripsy, and it's something that I've seen quite a bit of. I've been talking to different scientists in this area for some time. One of the things about the post, though, that's a little maybe different is that the post is, it says, it was posted by someone that says they're committed to science. When you click on one of the links in the post, it takes you to a hospital website, which is basically trying to recruit patients for the procedure. So I wouldn't really call this science. I'd call this more like marketing or lead generation. And the reason why I mention this is I'm not trying to criticize either the technique or the hospital, but this is the approach that's done very often, and many people will call this science, and it's certainly not science at all. It's more about client recruitment or patient recruitment, which is more in the marketing world than it is really science. One of the things that would have been nice to see is, hey, there's this new procedure, and it does like here's the pros, and then on the other side, here's the cons. So as an example, like anytime you talk about histotripsy, one thing to keep in mind is there's a lot of tissue destruction. So you're physically going to use, let's say, the sound and water to basically disintegrate all these cells or tissue. That some people could have strong reactions to that, and some people may not have any reactions that are noticeable. There's definitely some risks anytime you're doing this sort of energy ablation procedures. And then maybe a more important issue is one of eligibility. So you can't use this particular procedure for anyone with cancer. There's certain like pre-existing sort of guidelines or constraints to make people eligible. So one of the things is that if it's a tumor in the liver, the tumors have to be smaller than 5 centimeters and fewer than 6. And if it's tumors outside the liver, they have to be smaller than 1.5 centimeters and fewer than 3. So these types of limitations, they're not usually shared with people at the beginning. And so the idea would be, the more scientific sort of exchange of information. It'd be something like, hey, here's this technology that can be beneficial. Here's some of the benefits of it. Here's some of the, concerns about it, or at least limitations, maybe not concerns. So we could see right away if it's something worth pursuing or not. As always, I'm always a big promoter of exercise and basic nutrition for anyone with any medical condition. And hopefully this was helpful for you today.